Another way that our cholesterol gets raised is by having saturated fats. And these are found many different places. You can get them in oils, also in dairy products and animal products. That's why it's an issue. But when we have saturated fat, when we eat a lot of it, it actually stimulates our liver to start producing more cholesterol. So our poor liver, first of all, it makes what we need. And then if we eat an animal that has cholesterol in it, then we also are adding more cholesterol. And then if we're having foods that are high in saturated fats or trans fats, so this would be, as I mentioned, the animal foods, but also oils and frying that triggers our liver to start producing more cholesterol. So now we're getting cholesterol from like 3 different areas. And so that is what contributes to this rise in it. But also what contributes to a rise in cholesterol and blood pressure is that fiber has significantly decreased in all of our diets. And so I want to show you a chart on these on this document real quick. So we're going to talk a little bit about fiber and how that can lower our cholesterol and lower our blood pressure. Okay, so we are going to go to page 32, if I can get there. And because I think visually this will help you. So why is fiber an important player in blood pressure, hypertension, and cholesterol? Well, it does a couple of things for us. So fiber, it helps to remove excess cholesterol. So when we have too much, our body has a mechanism to use fiber that's found in plants to get rid of all that cholesterol. And so I can't tell you how many hundreds of patients I've worked with that have high cholesterol. And just by introducing more fiber into their diet, they're able to safely reduce their cholesterol. And it's because it is designed to grab onto that and remove it from the body. And now fiber also helps us to regulate blood sugar. So I mentioned we're going to talk about diabetes in a minute. This is a really big factor, is increasing fiber. It'll help you also to lower your cancer risk because it removes excess hormones. So if you have any hormonal issues, I had reproductive issues, right? That would be a hormone issue. Fiber can help to regulate those hormones. It also helps to remove carcinogens and toxins. And then it helps us with digestion. And I would say one of the most important features about fiber is that it fills us up, right? And when we're full, we don't reach for those other things. We don't reach for those fatty and sugary desserts and drinks and things that might be counterproductive to our health. So the fact that fiber fills us up is a big deal. So where do we get fiber, Katherine? Well, fiber, the definition of fiber is actually plant roughage. So that means it's found in plants, right? And so if you want to kind of see where you're at, here's an estimate, like just a quick way to estimate. You can see beans have 14 grams of fiber, one cup of beans. And so our goal needs to be around 40 grams. And most people are getting a fraction of what they need. So they're getting about 10, 12, 15 grams of fiber a day. And so if we stop and think about that for a second, like, wait a second, Katherine, you're saying that fiber can help us to reduce our cholesterol and manage our blood sugar, and then also reduce our high blood pressure. But then you're also saying that most people don't get enough of it. Well, it makes sense that these are some of our most common chronic illnesses, right? Heart disease, diabetes, and cancer. And so a big contributor to that is just simply lack of fiber in the diet.